Hi, everyone. My name is Adam Gans. I'm here to talk about building novel and protective mental health factors in the school setting, in particular as it relates to South Seattle youth between the ages of 13 to 17 years old that rely on Medicaid for insurances. This is ultimately going to be a very high level overview of what this project was about. So the health communication context is specifically targeting 13 to 17-year-olds in the state of Washington, in particular in the South Seattle area, as they are able to consent for their own mental health care. And those relying on Medicaid typically have reduced access to care in terms of number of psychiatrists, therapists, inpatient beds per capita, as well as have worse overall mental health and physical health outcomes. So the primary audiences, again, are those 13 to 17-year-olds that live within the South Seattle area. And the target and intermediate audiences are educators, community leaders, and school resource officers known as SROs. The goal of this is to build novel communication and programming that will ultimately lead a reduction in anxiety and depressive related disorders from pre-testing to post-testing. And this reduction should be statistically significant, as well as will be compared against national trends for better efficacy and generalizability. Now, addressing the social determinants of health is complicated. It requires background research. It requires understanding of theories, in particular, what this is really focusing on is social learning theory, the ecological model and its avenues of influence from individual to societal and policy level, the behavioral change methods that are applied to this, and the channels for message dissemination. To the right, we see an example of the table of the social determinants of health with all these levels associated with it. So SEL stands for social emotional learning, and that is one level of the social determinant of health that will be targeted through the COMP model via psychological capacity and physical capacity at the individual level from the ecological model. The measurable objective would be 70% of teachers feeling prepared to use it after course evaluations and surveys. But this requires being taught this, it requires guided practice, and it requires feedback. And so ultimately, this is bilateral, synchronous, non-mediated, as well as mediated platforms to help reach these educators, to help teach them, and to help ensure greater efficacy in using social emotional learning. Now, as it relates to the digital divide and social media campaigns, a lot of schools, especially in the Washington area, required to build the infrastructure to meet that need because of the COVID-19 pandemic. And with this being said, is that they have the ability to send, monitor, and generate digital links for distribution to students via text messaging, school laptop programs, and smartphone texting capabilities. Nearly 90% of all students have a smartphone or a phone that has access to the internet. But this also relies on philanthropic video encouragement from local sports teams to get better buy-in to these programs. And ultimately, in the end, having physical mailers is equally important to reach those that don't necessarily check their email that often or have unreliable access to the internet so that they know what's out there so they can encourage their children to participate. Now, evaluating how effective this campaign was requires formative research, process evaluation, and outcome assessment. So formative research will typically involves interacting with the community before the programs have been built to measure the attitudes, things they need to understand what would be beneficial for the students, as well as what is realistic in terms of being able to be achieved. And during this, in the initial phases, it will be quarterly programming and collection of data to gain better understanding of how well these programs are working. If the community is still in support and they feel that they're working, then that could be spaced out farther. If it's not working and it shows that it's not as effective, then routine monitoring can be increased to better understand what's not working and why it's not working. Now, for process evaluation, this is taken from the Saunders et al. Article and measuring methodology. So it's about fidelity, dose delivered, received, reach, and recruitment and context. It's about building campaign-related measures among the stakeholders and allowing for mid-campaign pivoting, as well as improvements and changes to be had. And this may require the use of a steering committee. And typically, this will be done during the building process of gauging all stakeholder views, attitudes, and feelings towards these programs and how effective they think that they will be. And then outcome assessment is measuring the fidelity of the program. So quarterly surveys from primary and target and intermediate uh, audiences is important so that it's reported to the stakeholders so that they know if these things are working. For instance, are students actually attending these things? Do they like them? Do they find them to be helpful? As well as comparing them against benchmark goals that are listed out in the paper. Now, the results will be sent to all stakeholders, target and intermediate audiences, as well as community leaders so that they're able to advertise what's happening, what they're doing, and how they're working to help improve the community. It does allow for mid-campaign improvements and changes if things are not working. Now, overall health campaign effectiveness will look and be statistically significant decreased differences between pre and post-test measures for mental health, including anxiety and depressive related disorders. And that will be compared to national trends and standards to determine if this is something that can be done on a national level. It will be increases in school attendance, as we know that those that rely on Medicaid have an increased number of missed days, as well as increase in after-school activity-related participation in non-athletic programs. There are studies that demonstrate non-athletic related programs tend to have beneficial factors, and not every student wants to participate in a sport. An increase in community partnerships is big too, as this helps tie the community together to help understand their needs, and it makes it a little bit more cohesive. Um, in terms of fidelity of how that's measured is a little bit more complicated, and that tends to be more with feelings of how well groups are feeling that they're working together. There will also be statistically significant increases in self-efficacy from pre-testing and post-testing for all taught and mandated teachings for social emotional learning, things for school resource officers, as well as efficacy in students feeling that they are able to attend those after school programs. I appreciate you guys listening to this very broad overview. If you have any questions or feedback, please let me know. And then here are my references. Again, thank you guys.